India aligns with shift in global guidelines for influenza vaccination, urgent need to prioritize preventives. Transition in accordance with WHO recommendation for flu vaccination, Bengaluru 23rd August 2025. Zydus Life Sciences Limited, including its subsidiaries affiliates hereafter referred to as Zydus, an innovation-led global life sciences company, held a health symposium at Bengaluru to create a convergence of leading healthcare professionals who spoke on the transition to a new influenza vaccination guideline as recommended by the World Health Organization (WHO) for Northern Hemisphere 2025-26. Global influenza remains a significant public health concern, causing an estimated 400,000 respiratory and 300,000 deaths across the world annually. In US and Europe, almost 50% of the population is vaccinated for seasonal flu annually. India, which successfully leads the universal immunization program.
Good evening, one and all. I am Dr. Jyoti GS. I am the professor and head of the Department of Obstetrics and Gynecological Department at Ramaya Medical College and Hospitals, Bengaluru. Today I have come here to speak about the importance of giving influenza vaccine during pregnancy.
Yeah, good evening, ma'am. There are just few questions.
Yes.
Why is it important for pregnant women to get vaccinated against influenza?
Yeah, it is very important. Why is it important? Because we know that pregnancy is a very vulnerable period where there are changes in the immune system, other physiological changes take place involving the cardia, the lungs. And during this period, if the pregnant lady contracts influenza disease, then it can lead to severe illness, which by taking influenza vaccine, it will halt the progression of severity. The severity of the illness could range from the patient being hospitalized, patient being admitted in ICUs, and even mortality. And not only that, it's not only protective to the mother, it is also protective to the baby. And the same thing happens in the baby also. If the baby of the mother suffering from influenza, then those babies are low birth weight babies, they go into preterm delivery, and these babies, small babies, preterm babies, they get admitted in NICUs, and again the morbidity and the mortality increases along with the cost.
What is the best time to give flu vaccine to pregnant women?
I would say any time during pregnancy, they should take one shot of flu vaccine. The WHO and the CDC recommends any time, but our Federation of Obstetrical Gynecological Society of India, FOGSI, recommends it in the third trimester, because the antibodies, when the mother takes vaccination, the antibodies passes through the placenta to the baby, and much better if it is nearer the delivery, because we have to take care of the first 6 months of the window period where the baby will not get any immunization with influenza.
How does maternal flu vaccination protect newborns?
Yeah, as I have already told you, because of the transit of maternal antibodies to the baby, what happens, the first 6 months the baby does not get any influenza vaccination for the baby. So during that window period, vulnerable period, again it helps to protect the baby against the complications of influenza.
Is flu vaccine safe during breastfeeding?
Yes, it has been proved that flu vaccine is safe and effective both during pregnancy and breastfeeding.
Do the medical bodies in India and globally recommend flu vaccine during pregnancy?
Definitely. That is why we are all here for that cause, because once the safety and the efficacy has been established, then only we can speak like this. Yes, it is definitely established.
One quick message you would like to give to people who are planning family about flu vaccine?
Yeah. I want to give awareness to all pregnant women or those who are planning pregnancy, and this giving the flu vaccine to pregnancy should be made a routine part of the prenatal care, and it should start prior to pregnancy. Nowadays we are seeing lot of high risk pregnancies, so those are the most vulnerable. Still, all pregnant patients should be given one shot of flu vaccine during pregnancy. And as I have been telling all that, if they plan the pregnancy and come to us beforehand in the preconception stage itself, then we can give them a health education, giving them the benefits of the vaccine and also the efficacy of the vaccine, and so that we can mitigate whatever the hesitancy they have and the complications which can occur because of influenza for the mother and the child. Dual protection.
Yeah, I'm Dr. Vinay D. I'm the infectious disease consultant at Apollo Hospitals, Banerghattaru.
Sir, why is flu still a major public health concern, especially in India?
The reason is simple. We have a large number of population and we have large number of vulnerable group of population. So when I say vulnerable, maximum population of children, maximum population of adults over the age of 60, maximum number of population with diabetes and bad diabetes, and maximum number of population where immunity is less, including those with cancers, those on treatment for cancers and HIV. So these are the vulnerable groups in India which are in maximum, and that's why it's still a public health concern. Also because vaccination is not part of the immunization schedule and most of these people do not take vaccine at all.
How does annual vaccination help in preventing outbreaks?
Because every year flu changes itself. It's an intelligent virus. So if at all we give the vaccine based on the previous year's recommendation, it doesn't help at all. So when there is an updated guideline, you take the vaccine as such, it will protect you and the vulnerable group of people, so the outbreaks will not happen at all.
What is the benefit of flu vaccination in practice?
In practice, like we already discussed, it prevents major illness. It will not prevent you from getting infected, but if you get infected, you have taken the vaccine, you will not have any bad disease, you will not get hospitalized. The chance of you entering into ICU is significantly lesser.
Who, according to you, should take flu vaccine?
If available, everybody above the age of 6 months should take flu vaccine, if available. But based on the current scenario, at least the vulnerable group, like we said, children, those more than age 60, immunocompromised group, diabetics and pregnant women.
Do doctors and hospital staff take flu vaccine?
Yes, most of the hospitals have a policy where it compels the staff to take vaccination, most of the hospitals.
One quick message you would like to give about flu vaccine?
Vaccinate yourself. So that's the simplest of the message possible. If you have an opportunity to spend less than 1,000 rupees on a vaccine, please take the flu vaccine.
So, मैं डॉक्टर परवेज़ गोल हूँ कश्मीर से हूँ एंड आज जो हमने मीटिंग करी इन्फ्लुएंजा वायरस और इन्फ्लुएंजा वैक्सीनेशन के बारे में. इन्फ्लुएंजा का सीज़न है आजकल कंट्री के बहुत सी स्टेट्स में, और इन्फ्लुएंजा एक जानलेवा बीमारी है और 1 बिलियन के करीब लोग हर साल इससे इन्फेक्ट हो जाते हैं, और 5 से 10% एडल्ट्स और 20 से 30% चिल्ड्रन हर साल इससे इन्फेक्ट हो जाते हैं, और तकरीबन आधे मिलियन से ज़्यादा लोग मर जाते हैं इसकी वजह से, इन्फ्लुएंजा और इसकी कॉम्प्लिकेशंस की वजह से. और ये इम्पॉर्टेंट है कि इन्फ्लुएंजा का वैक्सीन लिया जाए, जो एक मोस्ट इम्पॉर्टेंट प्रिवेंटिव टूल है हमारे हाथ में. इन एडिशन टू जो हमने कोविड के टाइम पे नॉन फार्माकोलॉजिकल मेजर्स किए, जैसे मास्क की, सोशल डिस्टेंसिंग, क्राउड्स अवॉइड किए, घर पे बैठे रहे. सो उन जो मोडेलिटीज़ हैं उनके अलावा मोस्ट इम्पॉर्टेंट जो अवेलेबल वैक्सीन है वो इन्फ्लुएंजा वैक्सीन है, और इन्फ्लुएंजा वैक्सीन रिकमेंडेड है 6 महीने के अलावा जिसकी भी एज हो उसको इन्फ्लुएंजा वैक्सीन एनुअली लेना चाहिए. ये हर साल लेना होता है, और अगर हर कोई नहीं लेता है, फिर जो हाई रिस्क ग्रुप्स हैं, जैसे बहुत छोटे लोग और जो उम्र में काफ़ी बड़े हैं, और जैसे 65 ईयर्स ऑफ एज से ऊपर और 5 साल से कम, और वो लोग जिनके ऑलरेडी क्रॉनिक लंग कार्डियोवास्कुलर डिजीज़, डायबिटीज़ हो या लिवर डिसऑर्डर्स या किडनी डिसऑर्डर्स हों, उनसे पहले ही अफेक्टेड हों, तो उनके लिए कॉम्प्लिकेशंस का रिस्क ज़्यादा रहता है, और उस वजह से उनको इन्फ्लुएंजा वैक्सीनेशन के लिए प्रायोरिटाइज़ करना चाहिए. इन एडिशन हेल्थ केयर वर्कर्स और प्रेग्नेंट फीमेल्स को भी प्रायोरिटाइज़ करना चाहिए इन्फ्लुएंजा वैक्सीनेशन के लिए. हर साल लेना चाहिए, हर एक को लेना चाहिए.